Every life is invaluable and precious. The problem of sudden cardiac death is a major concern for all people all over the world, affecting people of different age groups. When it comes to India, the problem has escalated due to a sudden change in lifestyle as well as food choices. When medical emergencies like cardiac arrest happen around a person, it is important to be prepared. If you are aware and informed, then you can take steps to revive a person and save his life. Worldwide, millions of people die of sudden cardiac arrest every year. This is partly due to limited and sometimes ineffective bystander cardiopulmonary resuscitation, also known as CPR. Many adults in cardiac arrest can be revived with intact neurologic function if the bystanders provide immediate CPR. Raising public awareness then and understanding of the practical applications of CPR is an essential strategy to increase CPR success in cardiac arrest cases. It is even more important to learn about CPR if you have a loved one who has a history of cardiac diseases, as research reports that the majority of cardiac arrests occur at home. Save a Life is an initiative through which people will be made aware of the early signs and symptoms of cardiac arrest so that patients can get to the hospital in time and also be trained on giving CPR if the need arises. Today we have with us eminent cardiologists who can help you understand sudden cardiac death and the role of CPR to revive and save a life. We have with us Dr. Ajay Kumar Pandey, consultant interventional cardiologist from Varanasi, joining us on the broadcast. Also, Dr. Amit Kumar Singhal joins us, senior consultant interventional cardiology at Fortis Escorts Hospital in Jaipur, and Dr. Anurag Mehrotra, the FACC chairman and chief cardiologist at Sidh Multi-Speciality Hospital in Moradabad. I'd like to begin with you, Dr. Ajay Kumar Pandey. You know, it's easy to think that all symptoms or signs of heart disease are obvious, but sometimes the first indication of heart disease is a heart attack. What are some heart disease symptoms people ignore?
Patients of heart ailments, they don't present with chest pain only. They also have a symptoms of, like dizziness, or they feel, exertional shortness of breath or exertional fatigability whenever they have some pointed towards a cardiac problem. Sometimes they have got abnormal heart rhythms or they have got a irregular heartbeats. And many times, like people, they get confused with the symptoms of indigestion in the stomach. But if you have got any such symptoms which were not there previously in your life, like having excessive sweating or compression like chest discomfort or exertional shortness of breath or feeling of unusual indigestion like symptoms. So all these symptoms may point toward a cardiac ailments and may not be very trivial symptom. So chest pain is not the only symptom in patients of heart disease, but we can say that, giddiness, dizziness, abnormal palpitation, exertional shortness of breath or exertional fatigability, feeling weak during an exertion, or feeling a indigestion symptom which were not there previously anytime to you, can also be one symptoms of cardiac ailments. And we should always be cautious about these symptoms. And if you have these symptoms repeatedly or they are troubling you, you should always see your cardiovascular physician or your doctor and consult them regarding for better investigation and, for further better diagnosis of your cardiac ailments as such.
Right, this feels like an appropriate time to bring in Dr. Amit Kumar Singhal. Doc, it's said that angina is a symptom caused by coronary heart disease. If you can explain to our viewers what is angina and what causes it.
So angina is basically pain of heart, right? Pain of heart is called as angina. It is a pain which is felt in front of the chest. So whenever coronary arteries get blocked because of multiple risk factors, that leads to deposition of cholesterol into the coronary arteries, like hypertension, diabetes, smoking, tobacco, alcohol, sedentary lifestyle and junk food, and stress. All these factors lead to progressive deposition of cholesterol into the blood vessels that narrows the blood vessels of the heart, that is coronary arteries. And because of that, on exercise, patient feels pain in front of the chest. This pain is known as angina and it is a pain of heart disease. Myocytes are compromised.
Right, Dr. Anurag Mehrotra, How can a person differentiate the pain of angina from a heart attack?
Ma'am, angina is basically defined as discomfort in chest caused by the heart or blockage in the arteries of the heart. Angina usually occurs on exertion initially. Exertion means whenever you do certain amount of work, it will occur, and it should have a repetitive character, meaning why you should come again after doing the same job. That is angina. It gets settled down after a few minutes of stopping that exercise or activity. Heart attack is basically a pathophysiological condition with the entity by itself, in which chest pain, prolonged chest pain is one of the symptoms. Prolonged chest pain is like the angina, but it is much more severe. It lasts long. It is usually accompanied by other symptoms of the profuse sweating, impending sense of death, and general sense of anxiety along with that. Patient will feel that he is not well. So and also angina-like pain, if it lasts for more than 10 minutes, we should think of heart attack. In certain conditions in which the pain sensitivity or threshold is disturbed in a patient, like in diabetes, pain will not be there or discomfort will not be there. Only symptom will be dyspnea or profound weakness and profuse sweating and sudden anxiety and impending sense of impending death. In very few number of patients, 10 to 20%, it may be silent.
Right. Dr. Ajay Kumar Pandey, we've heard Dr. Amit Kumar Singhal and Dr. Anurag Mehrotra brief us. But what should you do if you think you're having angina for the first time? If someone has been diagnosed with angina, does this increase their risk of a heart attack?
If somebody notices angina first time, it is really an alarming symptom. Why? Because angina is basically a pain which occurs on exertion or emotional excitement and usually get released by rest or by sublingual nitrate like tablets. And these symptoms are very classical for obstruction in the coronary arteries. We all know that we have got 3 coronary arteries and cholesterol get deposited in these arteries. And when these cholesterol arteries are blocked with the cholesterol, these angina-like symptoms can occur. So all such patients, those who've got symptoms of angina, they need to be investigated. They should see their physician, and we need to diagnose them by doing some stress test or diagnosis whether it's a definite angina or it was a non-cardiac type of chest pain, because this angina may be a serious problem, and if you neglect this angina or chest pain which occurs on exertion or emotional excitement and get released by rest, it can turn up into a heart attack, which may be a serious issue. And many times we see that patients, they were having these type of symptom previously and they neglect them and they don't get them investigated. So angina can lead to a heart attack, and it's a serious issue, needs to be investigated properly, and you should report to your doctor and you get your stress test done or whatever your cardiovascular physician says about for the diagnosis of angina. Maybe if the patient is having angina at rest, they needs to get investigated thoroughly by doing a coronary angiogram and looking for their 64 slice CT angio. So those investigations may be required in such patients, those who are having angina-like symptoms.
Right. Is it true that there's more than one kind of angina? And what are those types, Dr. Amit Kumar Singhal?
So broadly, we divide angina into 3 types: a chronic stable angina, unstable angina, and principal angina. So chronic stable angina is seen when there is a fixed occlusion or fixed block into the coronary arteries. And because of these fixed blocks, whenever a person starts exercise, at a particular level of exhaustion, patient starts feeling chest pain that is more or less stable and constant over days and months. Right? That is a chronic stable angina. At times, the patient feels progressive increase in symptoms. That is, now he or she is able to walk lesser, feeling pain earlier compared to previous time. So progressive increase in symptoms. This type of angina is known as unstable angina, and it is because of progression of disease. And the third type is the principal angina, where there is a no fixed occlusion or maybe some underlying fixed occlusion, but there is a component of spasm. So during stressful situations, coronary artery goes into spasm, and because of this spasm, blood flow is reduced in the coronary artery. That leads to pain. So these are broadly three types: a chronic stable angina, unstable angina, and prince-metal angina.
Right. This actually pushes one to question whether there are any triggers for angina. If yes, what are these triggers, Dr. Anurag Mehrotra?
Angina occurs when there is a critical blockage in the artery of the heart, coronary arteries. Yeah, or there is some disturbance in microvasculature of the heart arteries. Angina is usually triggered by activity. A certain amount of activity, be it walking, running, riding, climbing the stairs, doing certain kind of job, will precipitate that. It usually lasts for 2 to 3 minutes after stopping that exercise, usually gets subsided. It also gets subsided by taking sublingual nitrates. And it is usually, your question was how to get precipitated. It can precipitate, apart from exercise, can get precipitated by emotions, by sudden change in temperature, by having heavy meals and then walking for only slight duration or smaller duration. It can precipitate it. So any form of exercise, any form of emotional disturbance, any form of change in environment like temperature may cause that.
Crucial advice there. Well, our experts stay on with us to answer all your queries. For now, we're slipping into a very short break. Back in a moment. We're back with eminent cardiologists who can help you understand sudden cardiac death and the role of CPR. Dr. Ajay Kumar Pandey, now during cardiac arrest, what happens to a person? And for the benefit of our viewers, if you could please break down what a cardiac arrest is.
Cardiac arrest is a situation when the heart stops momentarily, and if you don't react immediately within 3 minutes of time, then the patient may die suddenly, or patient may have a brain death also. So cardiac arrest is a sudden cessation of the heart pumping activity. What we say that, heart keeps on pumping and gives blood circulation to whole our body, importantly our brain also. So whenever there is a heart stops temporarily, suddenly, that's called a cardiac arrest situation. It doesn't mimic like a heart attack, because cardiac arrest can occur in many more situations, not only in heart attack situation, but whenever the cardiac arrest occurs, if you start the CPR, what we say that, cardiopulmonary resuscitation, by pumping the heart artificially from outside, that start the process of reviving the heart, and that if that it cannot be done within 3 minutes of time, definitely the patient may have a brain death and may die. So cardiac arrest is a situation which if we act immediately, if we react immediately, we can save the person's life. And it is one of the most important way of saving people from cardiac arrest is to train other people, train general public and our junior colleagues regarding the cardiopulmonary resuscitation by doing cardiopulmonary. The first thing to do is a cardiac massage. We should start the cardiac massage immediately. So at least the immediate artificial pumping of the heart from outside that starts, and which gives the brain to survive for that initial phase. And then we can make the other things to tackle the cardiac problem, which has led to cardiac arrest, because there will be many causes of cardiac arrest. It can be a heart attack, it can be a brain attack, it can be loss of blood, it can be any anaphylactic reaction or allergic reaction. Anything can happen in that cardiac arrest situation.
But does CPR apply in both conditions, like cardiac arrest and heart attack, Dr. Amit Kumar Singhal?
See, CPR is cardiopulmonary resuscitation. Whenever heart gets stopped, in that condition, we have to provide a cardiopulmonary resuscitation, that is CPR. So in patients who are having a cardiac arrest because of any reason, whether it is because of heart attack or electric current injury or fall from height or drowning, for any reason, if a person develops cardiac arrest, in that case we have to provide cardiopulmonary resuscitation. In patient with heart attack, if patient is having heart attack but he is not having a cardiac arrest, in that case CPR is not required. So in heart attack patients, only those subset of patients of heart attack who develop a cardiac arrest, there only CPR is required. In other patients where there is a heart attack but heart is pumping and working, in that case CPR is not required.
Dr. Mehrotra, what steps should a bystander follow if they recognize that someone is having a cardiac arrest?
Hey, that's a very good, nice question. First of all, it is important to recognize whether it is a cardiac arrest. So if you see someone suddenly falling unconscious, so you will have to look into that. And first of all, you will have to confirm whether he has got pulse or not, he or she has got pulse or not, and whether he or she is breathing or not. You can do that by keeping your fingers on big arteries like carotids, if you know them, or you can simply put your palm in front of his nose to feel for the breath. If it is not there, you should take certain steps immediately. Inform another person which are around you to call for help, emergency help. And if you are confirmed of this arrest by doing the procedure I just told, you should start doing cardiopulmonary resuscitation.
Right, given the severity and sudden nature of the sudden cardiac arrest, response time and tactics are crucial as well for survival. But what is the role of cardiac rehabilitation for patients who have suffered a cardiac arrest? Dr. Pandey?
There's a very important role of cardiac rehabilitation in patients those who have suffered from cardiac arrest, because, cardiac rehabilitation is a process when we need to teach and train people, those who have come out of this cardiac arrest situation, how to get trained for the physical rehabilitation, for how to get their emotional support to provide to them, and how we can best give them, the whole total care of physical support, medical care, as well as emotional support. And this rehabilitation process is very, very essential, because many times patients get scared off when they come out of this cardiac arrest situation. They require sometimes the medical help. Physical rehabilitation is also required. And we have always seen that these people, they have suffered sometimes some sort of emotional trauma also. So we all require to give them an emotional support. And here comes a role of a team who gives not only the physical support, not only give them a training exercises, how to make their heart fit, but give them a support for their lifestyle intervention, how to live their life, in a peaceful way, how to get emotionally, stronger than coming out of these situations. And because we all understand that, our body not works alone, but our body works with the mind as well. So there's a mind-body medicine, and we need to support both the things together, not only our body as well as our mind. And just giving a support to this mind-body is basically our aim of doing a cardiac rehabilitation program in all such patients who have suffered from cardiac arrest.
Absolutely. Dr. Amit Kumar Singhal, you've heard Dr. Pandey. Now, how important is it to manage hypertension to reduce the risk of heart disease? What advice can you share for better management of hypertension?
See, probably hypertension is the commonest disease which we are facing in our country. Elderly people above the age of 18 years, 1/3 of our population is hypertensive as per data, right? So 30 to 33% of our population is hypertensive, and hypertension is a common risk factor, probably the most common risk factor for heart diseases. Progressive increase in blood pressure. A 20 millimeter of mercury systolic and 10 millimeter of mercury diastolic increase in blood pressure above normal increases the risk of heart attack by 2 times. So every 20 millimeter of mercury further escalation in blood pressure systolic or 10 millimeter of mercury diastolic increases risk of heart disease 2-fold, 4-fold, like that, right? So hypertension is a common disease and one of the commonest risk factor for heart attack. It leads to progressive damage to the blood vessel, progressive atherosclerosis, accelerated atherosclerosis, and narrowing of blood vessel leading to heart attack. So hypertension is a dangerous disease, it's a silent killer and a risk factor for heart attack. It is possible we can normalize our blood pressure. A proper diet, low salt, low fat diet, more of healthier food instead of junk and fast food. at the same time de-stressing ourselves, taking lesser of stress, regular physical activity, regular exercise. If by this we are able to control our blood pressure, then fine. If not, we may have to take medicines, right? So we can control our blood pressure with our proper diet, proper lifestyle, stress management, and if required, medicines. We should try to keep our blood pressure below 130 and below 80. Okay. So if we can keep our blood pressure in control with or without medicines, that will give protection to our heart and prevent heart disease.
Right. Dr. Anurag Mehrotra, now Dr. Singhal touched upon the diet briefly, but what type of diet should be followed by people with heart disease?
Now, I suppose most of us are very much familiar with what type of diet should we use. Important thing is to inculcate the habits where you should be able to eat the healthy foods only. So, my suggestion, we all know that any food which is high in saturated fats, sugars, and have got trans fat, they are all injurious. The important aspect is to eat more and more fresh, fresh food and raw vegetables and salads and fruits. Always try to eat the food made from home. If you will stick to this one habit, you will be saved of many of the problems. Most of the food which is brought from the market or restaurants or processed food or packaged food, fast food, or these type of dense food cause harm because they contain many of the things which are injurious to our heart. First of them being trans fats, and the other being high quantity of salt in them, a certain kind of preservative, which may cause problem with you. Our digestion, our microbiome, the type of bacteria we have in our abdomen, should be preserved, should be taken care of. It is very important and it's kept in right shape by having right kind of diet. Other important thing, if you stick to eating food and at least the major meal which mostly in most of the family occurs in the evening time, whole family should take one meal, that is evening meal together. So by taking this simple step, you can avoid many of the ills related to your diet, and not only diet. Many of the people they are in the habit of taking alcohol and these type of things. You will also get help in limiting those type of things if you are eating at home. Other thing is you must take conscious decision of what you are taking. You must take your lunch or whatever the diet you want from your in office from home. If it is not possible, insist that your canteen or whatever the outlet you go to take your food does have fresh fruits and salad and the type of things which are conducive to your health.
Right, eating food that's low in saturated fat, low in sodium and has no or less added sugars is key. And as Dr. Mehrotra said, eat at home as much as you can and choose plenty of fresh fruits and vegetables while you're at it. We hope this was beneficial for you. Thank you so much for watching.